What happened?
The internet. All right. My goodness. All right. This is the
Okay.
voice and the face of Living Spring Family Dr. Living Spring Family Internet. Please work very well today, please. We're doing another Facebook Live discussing the topic, Doc, my hair is falling out. Please help. And I'm here with the awesome Dr. Eman Yousif, who will be having this discussion with me on. I appreciate you. How are you doing, by the way?
Good, good. I'm glad to be here. Thanks for having me.
Awesome, awesome, awesome. All right. For those who are watching live, hashtag live, please, in the comments. And for those who are watching replay, hashtag replay. All right. So our first question to you is this, Doc. Kindly introduce yourself. Who are you and what do you do?
Yeah, so I board certified internal medicine. I do combination of outpatient and patient medicine. Right now, I'm located at Washington University in St. Louis, and yeah, kind of working on both ends of the spectrum.
Let's see. I'm glad you hung in there. Thank you. Trying to,
I'm in it.
trying to embarrass me today. We're live. Hang in there. All right. Um you said that you're working on both ends of the spectrum. So that's I did
Yep,
hear that. All right. So the
yep.
next question before why do you do what you do? Why do you do what you do?
Um, because I like, I like the combination of both right now. Seeing people when they're acutely ill, but also being there for them when they're able to prevent diseases and keeping them out of the hospital. So I like doing both of it right now.
All right,
Yep.
I see. I like. All right. So we're talking about hair loss and why this topic. Because I have quite a few patients that come in, they say, Doc, my hair's thinning out. It's affecting, my self-esteem, how I see myself. I can't explain it. What am I doing? So, what would you say are the most common causes of hair loss? Now we're speaking specifically about women.
Yeah. So I probably for women, I would say probably the most unappreciated common cause, in my opinion, is iron deficiency anemia.
Wow.
Affects like 20%, especially African American women, 19 to 12% of the general population of women in general. And it's not something that we often discuss. And so to me, that's important to appreciate. Other causes, thyroid diseases that we know about, vitamin D deficiency, and hormone disturbances like PCOS, that sort of thing. And then sort of the run of the mill type things like acute stress. The most common one that we know about are events like pregnancy, um, as well as diet and trauma.
Let me see if I can use. Oh,
Yeah, it's super,
oh,
the internet.
the internet is really, really messing this up. Um, all I got was the PCOS, vitamin D, and I think you were talking about stress as a acute stress as a cause.
Yeah,
Um,
so yeah, that's pretty much where we got, and then before it got blaggy. But yeah, so pregnancy, common acute stress, like we said, any major changes in diet. So if you go from eating a well-balanced diet and then make a drastic change, that can be sort of like a shock to the system. Or if you start going from being moderately doing moderate exercise and then doing acute, like starting to run a marathon all of a sudden when your body's not accustomed to it, that sort of thing, for sure. And I've seen it a couple times in the clinic.
wow.
So yeah.
Okay, and then anemia too. I think you mentioned that too.
Yeah, iron deficiency anemia, or anemia in general, any sort of disorders in your hemoglobin disorders, for sure.
Okay, I was surprised. I'm seeing a lot of vitamin D deficient present as hair loss.
Yeah,
It's crazy.
yeah.
All right. So next question would be, are there tests? Now, of course, you've mentioned some of the causes. So are there tests that you need to do for someone who's saying, oh, I don't know why, I want to figure out the root cause? What would you say to that person as far as tests?
Yeah, I think we can get a lot of information, and I don't know how you feel about it, but I feel like you can get a lot of information just from a basic metabolic panel,
Sure.
CBC, thyroid, B12, and then you can sort of expand. Like if you're anemic, go to B12, folate, zinc, that sort of thing. But just the kind of standard panel gives you a decent idea, and then you can potentially delve deeper after that.
Okay. So sometimes just a basic test would be
Yeah,
good to figure out, most common before we start going into the zebra cases, right? Um,
exactly.
Now I have some patients who ask, like, "Oh my goodness, is this going to be the new norm for me? Is it permanent? Will it grow back? How do you tell your patient, like, how would I know if it'll grow back?"
Yeah, so I try to get an understanding basically of the history, what was going on in the last couple of months. Is this
Okay.
something that's happened more acutely, or is this something more sudden? And it really depends on what type of hair loss we're talking about. If it's the more typical female pattern, or what we call non-scarring hair loss, or telogen effluvium, that's the typical hair loss that happens when you have some sort of underlying deficiency or stress. It's often a reversible cause. Starts 3 months after an acute event, so that's why a history is really important. And then that kind is fully reversible, can grow back after about 6 months, once you identify the cause. So if you're vitamin D deficient, you have iron, your iron stores are low, you just replete that. After 6 months, you should start to see some growth. The other
6.
less common, yes, 6 months. Well, it should start to get growing. All
Can you
right,
hear
we're
me?
back. Yeah. I think it's just gonna be off
Yeah,
and
we're
on.
back in and out. 6 months, you said. Someone who's watching is like, "Oh my, to wait. 6 months is a long time to wait." But there are other things to do while you wait the 6 months to figure out what's going on, treat the underlying cause of it,
Yeah,
right?
yeah,
Um,
yeah.
Wow. Okay. I got my backup on now, so I think we should be. I'm so sorry for this, but
Oh no,
thank you for being
not
a
at
good
all.
sport about it and going along with it. Now, the last thing you said about the hair loss permanent or the will it grow back, we said about 6 months, we find out the underlying cause. Um,
Hmm.
Now, are there diets that can help restore hair? And then someone's asking a question actually before we go into that one. Said you mentioned trauma as a cause. So can you
Hmm.
elaborate on that? Good question, Miss Melissa. Miss Melissa.
Yeah, so sudden loss of like a family member, seen it with that, really like any traumatic event. But I mentioned bereavement because that's a pretty serious traumatic event.
Stressful.
Yeah, but if anything in your life that potentially may have happened that's significantly stressful, I mean, you hear about even like as you know, like Takotsubo, acute stress and how that can affect the heart.
Hot.
It's the same sort of, yeah, it's the same sort of mechanism. Any sort of that acute stress event can affect other areas of the body.
Even surgeries. I've seen patients after surgery lose their hair.
Yeah,
After
exactly.
pregnancy because it's a shocker of your body.
Exactly. It shock to your
Um,
body. Yeah, surgery, that's a good point. That's a common one too.
yeah. So those, but thank you for that question, Doc. I appreciate
Yeah.
that. Then are there diets that help restore hair? Like, what are tips for someone who say like, I know you said 6 months, but is there anything I can eat or take to speed up the process? What would you say?
Yeah, definitely a well-balanced diet. But kind of I would take inventory on how much protein you're potentially eating. You need essential fatty acids to help, hair follicle growth. Your hair and skin are still cells, organisms, organs, and we need to fuel that. So definitely pay attention to how much protein and iron you're taking. Vitamin C is helpful, and especially if you identify as some, the root cause of hair loss may be related to like folic acid, biotin, zinc, that sort of thing. So you could potentially eat foods that are rich in that as well. So those things are helpful.
Protein rich, because your hair follicles are made up of collagen and
Exactly. Yeah.
protein.
So,
So you got to eat protein rich foods.
yep.
And you had mentioned earlier those who go to a radical diet sometimes can have the hair loss happen because they're deficient in something and their body is working
Yeah.
much harder and burning up some of their vitamins. So very, very
Exactly.
important to make sure diets are balanced. Now,
Yep.
would you say there are diets that worsen the chances of your hair growing?
So I would be very careful if you're on a vegan or vegetarian diet. I think that's the one that I see, mix up a lot of people because it's, touted as a healthy diet. Anything that's away from the standard American diet, I agree, is very helpful. But it's in from what I've seen, it's you've got to be really careful, like in terms of how much iron you're taking, and if you're not, make sure you're supplementing. I think that's the one that's probably the most susceptible. I think that, yeah, I can't think of any other ones, but those two probably.
Yes, the B12 deficiency associated with sometimes vegetarian diet. So making sure you're getting supplements to augment
Exactly.
where you may be deficient is very, 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 very important.
Yeah.
And, you know, I would say if you stay away from a protein-rich diet, then you're liable, right? So what are
Yeah.
proteins? Your beans, your
Exactly.
eggs, biotin, egg yolks, especially um,
Exactly. Yeah.
avocado seeds, and spinach. And studies have shown that eating a predominantly processed food diet can cause your hair to fall off. I didn't
Yeah.
make that up,
Absolutely.
I promise.
I mean, that's what we should say. Processed diet causes hair loss.
It
That would
can
be the
make your hair
headline.
fall off, and it makes your hair thin. So please, more fresh fruits and vegetables, more proteins, healthy whole
Yeah.
grains are good for you. Now, what would you say is a good hair care routine, right? What would you say to someone who's like, are there hair care routines you would suggest so that I make sure I keep my hair as long as I can? What would you say to them?
Yeah. Um, So just the kind of standard things. So harsh chemicals, excessive heat, um, blow dryers, straighteners, that sort of thing. Try not to wear any tight hairstyles that can certainly tug on a lot of the hairs that are still working on growing. Yeah, for sure. I mean, I'm doing the same too. too. But yeah, and then it's kind of scalping or massage that can stimulate some
Oh, scalp
blood flow to
massage.
the area.
Okay.
Yeah,
Doctor,
that can
doctor
help.
ordered. Scalp massage. I like it. I like it.
Yeah. Oh, and then an important one that I am also not very good at doing, but wearing a hat outside if it's sunny, protecting your
Mm.
scalp from the heat, that can also help as well.
Ah,
So,
I like the
yeah.
scalp massage one, and then we work on
Yeah, I mean, that's always a good one. It's
we work
therapeutic.
on the hat. We work on the
Yeah.
hat. This has been very, very helpful. I really apologize for the technical difficulties, but I believe we learned a thing or two about how we can increase the chances of
Yeah.
preserving our hair. The real one to last us as long as possible. We talked about diet. We talked about common causes. We talked
Mhm.
about things to avoid and things to maybe enhance. So I
Yeah.
appreciate you, Dr. Eman, for coming. But for someone
Oh,
who's
thank you for
watching,
having me.
who's like, this doctor is very patient. She stayed the whole time through the internet issues. How can people find you, Doc?
Yeah, well, first of all, I had a great time. It's always fun. But probably right now, Instagram is the easiest way to find me. It's my first name, Iman, B, and then Yousif, Yousif. It's the easiest way to find me.
At Instagram. And I'll be sure to put that after the live. But
Hmm.
thank you so much for joining. Thank you, Dr. Melissa Chamberlain, for asking that question. That was very good. And thank
Yeah.
you for staying on. I appreciate you. And for those of you who are watching and who are looking for a thorough, a passionate, and a caring family physician in the Mansfield, Texas area or surrounding, I am she. Thank you for watching and staying through with us. Bye.
Mhm.
Thank you, Doc.
Thanks.